everybody, my name is Lilian Momina. I'm a clinical nutritionist, and today I want us to discuss about the early warning signs of inadequate breastfeeding. If you've just had a baby, congratulations, or you're pregnant and you're expecting, congratulations. You'll be a great mom, and we're going to walk with you through this journey. And yeah, feel free to ask in the comment section any question that you might have regarding nutrition and breastfeeding. We'll be more than glad to tackle it. You've had a baby, now you're concerned, is my baby getting enough milk? Am I producing enough? We are here to answer all those questions. So breastfeeding is a very, very important journey in motherhood. It is an essential and complete meal for the baby. It has all the nutrients that the baby requires for growth, development, and nourishment for the first 6 months of life, without taking any other fluids, even water included. For promotion of exclusive breastfeeding within the first 6 months, it is necessary for the mom to be able to produce enough milk for the baby. If you've not watched the tips of how to produce enough milk for your baby, I will link down the link below so that you can have a look on how to increase your milk supply. You've had a baby, you've gone home, and it's 5 days, you've not gotten the milk flow, the downpour, the milk flow has not started coming out. That is concern number one. 120 hours after delivery, after childbirth, and you've not gotten any milk, there's nothing that is coming out from your breast, you need to make sure that you go back to the hospital, have it addressed. You can check with your pediatrician, you can check with your nutritionist or dietitian to see what we can do to make sure that the baby is getting enough feed. So we don't want to dehydrate or to starve the baby. 5 days is a lot. If it's gotten to that point and you're latching the baby, you're putting the baby on the breast as instructed or as told, and then there's nothing, there's no blood flow, there's nothing that is coming out of the breast, you need to make sure that you get back to the hospital because you don't want to starve the baby. That is the first and the most important risk factor of inadequate breastfeeding. The second one is after the 2 weeks period after delivering, you're given a return date after 2 weeks to the clinic for assessment, to you to be assessed on over bleeding, to be assessed if you're breastfeeding and latching the baby well, to be assessed on like how you're doing as a mom. The other concern that you should have after the 2 weeks is the weight of the baby. If after the 2 weeks the baby has gone below the birth weight or has not gained any weight at all, there's no increase in even the grams, even the 0.2 grams, this is a direct indication that your breast milk is not providing enough nourishment for the baby, and adjustments need to be done so that you make sure that you provide enough for the baby and it is necessary. So when you go for that clinic, when you go for that checkup, as you're being checked on your bleeding, you're being checked on your wound healing, you're being checked on your breastfeeding like attachment and latching and all that, so that you ask or you prompt, if they forget, you prompt and ask about the baby's weight. If the baby is not added, that is a direct sign that the baby is not getting enough food, or there is something in their gut that is preventing the utilization of their nutrients from your breast, and that needs to be checked out. Also, after delivery, you can keep a record for the first 2 weeks. Please keep a record on how frequently the baby feeds. The third one is frequency of feeds, of course. So you've given birth and you're like, my baby sleeps all through the night, and you're happy. That is not good. I know as a new mom you'd like that, and you'll be like, oh my god, let this child sleep so that I can rest, because you're tired, motherhood is hard and everything. You want to heal, you want to rest, but that is not good. You need to make sure that you're waking that baby up every 3 to 4 hours so that they can feed. Again, it is necessary in the first few weeks for you to do this so that you establish a routine, so that your body is stimulated enough so that it can be producing enough for this baby for the next 6 months. If you don't stimulate, the body will not produce. If they sleep for more than 3 hours, you wake them up in the 4th hour, wake them up, feed them, latch them in the breast and let them feed. If the baby is sleeping all through the night, please just put an alarm, wake them up every 3 hours. I know it's a lot of work, but it will get better after the 6 months period is over. So after the 6 months period, and then the baby has started feeding, then you can get away with sleeping all through the night and allowing the baby to sleep away through the night. But before then, please don't. It is not a good sign. The stomach size is very, very tiny. When the baby is small, the capacity they can hold in the tummy is also very, very small. So if they sleep all through the night, of course they are going to be hungry and they are going to be deprived of nutrients. The other thing that you need to look out for is the number of wet diapers or wet napkins that you're going to have. When you're breastfeeding, you need to make sure at least you change the baby 6 times, wet diapers, and the stool also. The baby should poop at least 2 to 4 times if they are feeding well. And the consistency, color, and the quality of the poop. I know it sounds disgusting. It can be, but it's motherhood. It's not as easy as it sounds. Again, keep a diary or keep a record of how many times you change the baby, how many times they poop, the color, the frequency, and the consistency of the poop. And the other thing that you can check is the breast engorgement. Of course, when your breast is engorged, it becomes very, very hard, and it will affect the suckling because the baby cannot attach well. So if your breasts are engorged, you tap with warm water, you massage yourself, then try as much as you can to express them so that they become tender so that the baby can breastfeed well. Another cue that you would want to look out for is like if you're having pain in your breast, like the tenderness, the sore nipple, because involuntarily you would want to avoid the baby suckling because of that pain. And you see this again with reduced stimulation. Stimulation reduces production, and then production reduces the quantity and the quality the baby is getting. I know it's painful. I know it's very, very hard to breastfeed. You're feeling pain around the breast area. You can use some nipple cream, and you can also just pat with some warm towel. Don't breastfeed a baby if it's open wound because it can cause some infection and then transfer the infection to the baby. Express if you have to, but make sure the baby is getting the milk. Don't hold the milk. It is hard psychologically, and you might find yourself not wanting to breastfeed. You're not a bad mom. It is very, very normal, and it will come to pass. The pain will go away as you learn the proper latch. If you're experiencing like painful nipples, you just make sure that you work on your attachment. The baby is to be attached properly around the alveoli, and make sure that when they're suckling, that sound does not come out. That you make sure that they're attached well. Also, position the baby well. Apart from attachment and latching, position them well. Make sure that your hand touches their butt so that you can have in your stomach zinaangaliana, they face each other. So when you're attaching the baby, breastfeed, and make sure that the baby breastfeeds. Another thing that you can look for is the baby crying immediately after a feed. You've just fed the baby, then immediately after feeding the baby starts crying. Like you're seeing the hunger cues. They're still moving their mouths as if they're looking for the breast milk and all that. This shows you the baby has not gotten enough. They're still hungry and they need to feed more. So when this happens, just make sure that you stimulate enough, work on their diet. And another that you can also look on is not having appetite after childbirth, because the body will need more nutrients for breastfeeding. There's adaptation in terms of hormones and behavior that comes about, and this will trigger more appetite for the mom. So this is supposed to take care of the increasing nutrient demands that come with breastfeeding. So you having appetite when you're breastfeeding is not an off thing. It is very, very normal. It's not something that is off. It's very, very necessary. Even the community is supposed to help you get the extra food so that they can feed you the extra feed so that you can have enough for you and the baby. It's also recovery, and that you need to produce enough milk for the baby. If you gained enough weight during pregnancy, you might need an extra 1 nutrient-dense balanced meal a day. If you did not gain enough, you might need 2. If you gained extra, you might need less. So you may need just a normal snack, maybe a uji or a broth here and there, to continue with the increasing nutrient demands for breastfeeding. Feed your kid with balanced meals because it is hormonal and it is mediated by the system to make sure that you're providing enough for this baby. If you avoid it and you don't feed it, what will happen? Breast milk supply, breast milk production will go down, and that is not what we want. We want to make sure that we have enough for the baby and enough for you. Another thing that you also need to look for is the duration of feed. How long or how short the baby feeds. If the baby is feeding too long in one breast, it might mean they're not getting enough. The ideal time for a baby to breastfeed to get all the necessary nourishment from breast milk is supposed to be anything between 8 and 15. That is okay. So if the baby feeds for more than 15 minutes, you need to understand that this baby is trying to get the nutrients that they have not got. They're still hungry, so they're trying to get some more milk from you. Then if they also get feeding less time, they might get bored from suckling and nothing is coming, also they'll cry. That is it for today. I hope you learned a thing or two about motherhood. It's a beautiful journey, and embrace it, and let's breastfeed those babies at least for 6 months, and then after 6 months we'll talk about definitely weaning and complementary feeding and such things. Thanks for listening. Bye.